After 60, one of the biggest mistakes people make with knee pain is believing the knee is simply worn out. Because here is what most people are never told clearly enough. Your knee pain may not be coming from the place you think it is. It may not be just cartilage. It may not be just age. And it may not mean you are destined to give up walking, stairs, gardening, travel, or getting down on the floor with your grandchildren. Sometimes the painful knee is only the final alarm bell. The real problem may be weak muscles, hidden inflammation, poor joint loading, extra pressure with every step, or a nervous system that has learned to keep the pain alarm switched on. And this matters deeply after 60, because knee pain does not just affect the knee. It can quietly shrink your life. First, you stop taking longer walks. Then you avoid stairs. Then you sit more. Then the muscles around the knee get weaker. Then the knee hurts even more. That is the pain spiral. And today, I want to show you 7 knee pain secrets that can help you understand what is really happening inside the body. I'm Dr. Leana, and before we go further, remember this is education, not a personal diagnosis. If you have severe swelling, fever, redness, sudden deformity, a recent injury, calf swelling, or you cannot bear weight on the leg, please get medical help promptly. But if your knee pain has been slowly creeping in with age, arthritis, stiffness, or weakness, these 7 secrets may change how you think about your knees. Secret number 1, your X-ray is not the whole truth. Many people over 60 hear the words arthritis, bone on bone, or cartilage loss, and they immediately think, that's it. Nothing can be done. But the body is more complicated than that. An X-ray can show joint space narrowing, bone changes, and signs of osteoarthritis. But an X-ray does not always explain exactly how much pain someone feels. Some people have terrible-looking X-rays and still walk fairly well. Others have mild imaging changes and intense pain. Why? Because pain does not come only from cartilage. Cartilage itself does not have the same nerve supply as many other tissues. The pain often comes from the tissues around the joint lining, the bone beneath the cartilage, the ligaments, tendons, muscles, and the irritated tissues that respond to stress. Think of the knee like a house. The cartilage may be the flooring, but the pain alarm may be coming from the walls, the wiring, the foundation, or the security system. That security system is your nervous system. When a knee has been irritated for months or years, the nerves can become more sensitive. The alarm becomes easier to trigger. A normal step may start to feel threatening. A small twist may feel bigger than it really is. This does not mean the pain is imaginary. It means the alarm system has become overprotective. And that is good news, because while we cannot always reverse every structural change in the joint, we can often improve the environment around the knee. We can strengthen the muscles. We can reduce excessive pressure. We can calm inflammation. We can improve balance, walking mechanics, and confidence. So do not let one X-ray sentence your future. Your knee is not just a picture. It is a living joint inside a living body. And that leads to secret number 2, rest can become a trap after 60. Now let me be very clear. If your knee is swollen, hot, irritated, or flaring after overdoing it, short-term rest can be useful. The body sometimes needs a pause, but long-term rest is different. Long-term rest can quietly weaken the very system that protects your knee. The muscles around your knee act like a living brace. Your quadriceps in the front of the thigh, your hamstrings in the back, your calf muscles, and especially your hip and glute muscles all help absorb force when you stand, walk, and climb stairs. When those muscles weaken, more of the load goes directly into the knee joint. So the painful knee makes you move less. Moving less weakens the muscles. Weaker muscles increase joint stress. More joint stress increases pain. That is how rest becomes a trap. This is where many seniors get stuck because they believe movement will grind the knee down. But the right kind of movement is not punishment for the knee. It is nourishment. Gentle movement helps circulate joint fluid. It brings blood flow to the surrounding tissues. It keeps the muscles awake. It tells the nervous system, this joint can still move safely. The key is not heroic exercise. The key is tolerable, repeatable movement. A short walk, a few minutes on a stationary bike, gentle water exercise, slow chair sit to stands, simple range of motion movements before getting out of bed. You are not trying to prove how tough you are. You are trying to teach the knee that movement is safe again. A useful rule is this: discomfort during exercise should stay mild to moderate, and it should settle afterward. If pain spikes sharply, swelling increases, or you are worse the next day, that was too much for now. The goal is not to force the knee. The goal is to reintroduce movement like medicine. But here's where it gets even more interesting. Secret number 3, the knee often hurts because the hips and thighs are failing it. Most people point exactly where it hurts and say, this is the problem. But the knee is trapped between two powerful neighbors, the hip above it and the foot below it. If the hip is weak, especially the muscles on the outside and back of the hip, the thigh can rotate inward when you walk or stand from a chair. That can make the knee collapse slightly inward, even if you do not notice it. Over thousands of steps, that small collapse can change how pressure moves through the joint. The knee is not just bending and straightening, it is constantly responding to forces from your hips, ankles, feet, and spine. And after 60, muscle loss becomes a bigger issue. We naturally begin losing muscle with age unless we actively protect it. This age-related muscle loss is one reason stairs become harder, chairs feel lower, and the knee feels less trustworthy. Your knee may not need less movement. It may need better support. That support comes from strength, not bodybuilder strength, functional strength. The kind of strength that helps you get out of a chair without pushing with both hands. The kind that lets you step onto a curb without fear. The kind that allows your knee to track properly when you climb stairs. One of the simplest movements is the sit to stand. Sit in a sturdy chair, feet flat. Lean slightly forward. Stand up slowly. Sit back down with control. At first, use your hands if needed. Over time, use less help. That one movement trains the thighs, hips, balance, and confidence. Other helpful options may include straight leg raises, wall-supported mini squats, side leg raises, gentle step-ups, and calf raises, depending on your ability and pain level. And this is where a physical therapist can be incredibly valuable because form matters. The right exercise can help. The wrong version, done too aggressively, can irritate the joint. But do not miss the main point. A painful knee is often a weak knee. A weak knee is often an unsupported knee. And an unsupported knee absorbs stress it was never meant to carry alone. Now, secret number 4 is one of the most eye-opening. 1 pound of body weight is not 1 pound to the knee. Many people think, I only gained 10 pounds. How much difference could that really make? But the knee does not experience body weight as a simple number on a scale. When you walk, your knee absorbs multiplied force. With each step, the pressure across the joint can be several times your body weight, depending on speed, incline, stairs, and walking pattern. So even a small amount of extra weight can become a large amount of repeated pressure over the course of a day. This is not about shame. This is not about appearance. This is about physics. If your knee is already irritated, every extra pound is like turning up the pressure dial with each step. And here's the part many people miss. You do not always need dramatic weight loss to feel a difference. For some people, losing even 5 or 10 pounds may reduce the load enough to make walking easier, especially when combined with strengthening. But weight loss without muscle protection can backfire after 60. Because if you lose weight by under-eating protein, skipping meals, or doing crash diets, you may lose muscle along with fat. And if you lose muscle, the knee loses part of its support system. So the smarter goal is not just lose weight. The smarter goal is reduce joint pressure while protecting muscle. That means enough protein, resistance exercise is tolerated, fiber-rich foods, and steady habits you can actually maintain. And that brings us to the secret that connects the knee to the rest of the body. Secret number 5. Your belly and your knee may be talking to each other through inflammation. Most people think knee pain is purely mechanical. Cartilage wears down. Bone rubs. Knee hurts. But that is only part of the story. There is also a chemical story. Fat tissue, especially deep belly fat around the organs, is not just stored energy. It can behave like an active chemical organ. It can release inflammatory signals into the bloodstream. Now, inflammation is not always bad. Acute inflammation is part of healing. If you cut your skin, the redness and swelling are part of the repair process. The problem is chronic low-grade inflammation. That is the quiet internal fire that can simmer in the background for years. After 60, this matters because chronic inflammation can make joints more irritable, slow recovery, worsen insulin resistance, and amplify pain signals. Imagine the knee as a room with a small fire in the corner. Mechanical stress is one spark. Weak muscles are another. Extra pressure is another. But chronic inflammation is like dry air in the room. It makes everything catch faster. This is why food quality can matter for knee pain, even though food is not a replacement for medical treatment. A more anti-inflammatory eating pattern may support a calmer internal environment. That means more colorful plants, beans, lentils, berries, leafy greens, olive oil, nuts if tolerated, fish such as salmon or sardines if appropriate, and enough protein to protect muscle. It also means reducing ultra-processed foods, sugary drinks, and refined carbohydrates that can worsen blood sugar swings in some people. This is not because one magic food rebuilds cartilage overnight. That is not honest. The real benefit is deeper. Better food can support healthier weight, better blood sugar, improved muscle maintenance, and lower inflammatory pressure in the body. And when the whole body becomes less inflamed, the knee may become less reactive. But be careful with supplements. Turmeric, fish oil, collagen, glucosamine, and other products are often marketed aggressively to seniors. Some may help certain people, but they are not miracles, and they can interact with medications. If you take blood thinners, diabetes medication, blood pressure medication, or have kidney or liver disease, speak with your clinician before adding supplements. Food first, movement first, strength first. Medication and supplements only with good guidance. Now, secret number 6 may sound simple, but it can protect independence. The small tools are often the tools that keep people moving. I am talking about canes, braces, supportive shoes, topical anti-inflammatory gels, aquatic exercise, tai chi, and physical therapy. Many seniors resist these tools because they feel like signs of decline, but that is the wrong way to see them. A tool that helps you move is not a symbol of weakness. It is a strategy for independence. A cane, used correctly, can reduce load on the painful knee and improve confidence. The key is that the cane is usually held in the hand opposite the painful knee. If the right knee hurts, the cane often goes in the left hand. This helps share the load across the body. A brace may help some people feel more stable or improve alignment, especially during activity. Supportive shoes can reduce unnecessary stress from the ground up. Tai Chi can train balance, control, and gentle strength. And balance matters after 60 because knee pain often changes how people walk, and altered walking can increase fall risk. Topical anti-inflammatory gels may also help some people with knee osteoarthritis pain. They are applied to the skin over the painful area, and for some older adults, they may be preferred before oral anti-inflammatory pills because they can have less whole-body exposure. But less exposure does not mean zero risk. If you are on blood thinners, have kidney disease, stomach bleeding history, heart disease, uncontrolled blood pressure, or take multiple medications, ask your doctor or pharmacist before using anti-inflammatory medicines regularly, even topical ones. And injections? Corticosteroid injections may reduce pain for some people for a period of time, especially during flares, but they are not a cure. They should be discussed carefully with your clinician, especially if you have diabetes or repeated injections are being considered. The secret is not that one tool fixes everything. The secret is that the right combination can keep you moving long enough to rebuild strength. Pain relief that only makes you sit is not enough. Pain relief should create a window where you can move better, strengthen safely, and regain function. And now we come to the most important secret. Secret number 7. The real goal is not zero pain. The real goal is breaking the pain spiral. This is the mistake that keeps so many people trapped. They wait for the pain to disappear before they start moving again. But often the pain improves because they start moving in the right way. Not aggressively, not carelessly, not through severe pain, but gradually, intelligently, consistently. The knee needs a better environment. It needs stronger shock absorbers. It needs less unnecessary pressure. It needs calmer inflammation. It needs better balance. It needs safer movement. And it needs a nervous system that stops treating every step like danger. So instead of asking, how do I make my knee pain vanish by tomorrow? Ask a better question. How do I make my knee feel safer, stronger, and less irritated over the next 8 to 12 weeks? That question changes everything. Start with 10 minutes of gentle movement most days. If 10 minutes is too much, start with 5. If walking hurts, try stationary cycling or water exercise. If mornings are stiff, use gentle range of motion before standing. Some people feel better with heat before activity and ice after swelling or flares. Then add strengthening 2 to 3 times per week. Begin with what your body can tolerate. Sit to stands, supported mini squats, straight leg raises, side leg raises, or guided physical therapy exercises. Track function, not just pain. Can you walk a little farther? Can you stand from a chair more easily? Can you go upstairs with more confidence? Does morning stiffness settle faster? Do flares recover sooner? Those are signs your knee environment may be improving. Pain is important, but function tells a bigger story. And please do not ignore warning signs. If your knee suddenly swells, locks, gives way severely, becomes red and hot, or pain follows a fall or injury, get evaluated. But for the common, stubborn, age-related knee pain many people face after 60, the message is this: your knee may not be broken beyond hope. It may be undersupported, overloaded, inflamed, and overprotected by the nervous system. That can be worked with. So let's bring the 7 secrets together. Your X-ray is not the whole truth. Too much rest can weaken the knee's protection system. The hips and thighs may be causing more knee stress than you realize. 1 pound of body weight can create multiplied pressure with every step. Belly fat and chronic inflammation may make the knee more irritated. Small tools like canes, braces, topical treatments, water exercise, tai chi, and therapy can preserve independence. And the real goal is not chasing perfect pain relief before you move. The real goal is breaking the pain spiral. Because once pain makes you stop moving, the body begins to shrink its own capacity. Muscles weaken. Balance declines. Confidence drops. The world gets smaller. But when you rebuild gently, the opposite can happen. Movement becomes safer. Strength returns. The joint becomes better supported. The alarm system may calm down. And life can start opening again. So today I want you to think about your knee differently. Not as a worn-out hinge, but as a living joint that needs the right support, the right load, the right fuel, and the right plan. And if this helped you, tell me in the comments, what bothers your knees the most after 60? Stairs, walking, getting out of a chair, or pain at night? Like this video, subscribe for more health guidance with me, Dr. Leana, and share this with someone who believes knee pain means they have to stop moving. Because sometimes the most important step toward less knee pain is not doing more. It is finally doing the right things in the right order.